Again, another example, this time in a patient with mild non-proliferative retinopathy who's also got evidence of maculopathy. There's a small change on the infrared reflectance image corresponding to a microaneurysm, and then generalized absorption of the infrared reflectance centrally. Again, when we look at the OCT cross-section, the structural change on the OCT corresponds to the area of absorbed reflectance on the OCT image. And again, clearly we can see intraretinal fluid and subretinal fluid on the OCT cross-section.
I'd like to just emphasize this with a case of a 30-year-old patient, type 1 diabetes, who represented to my clinic with a 2 to 3 month history of blurred vision. This was his color fundus photograph. Again, he's got advanced proliferative diabetic retinopathy. You can see that pre-retinal hemorrhage inferiorly with that large venous loop overlying the infratemporal arcade with exudation at the macula. You can see that large area of retinal vessels nasal to the optic disc. And this is despite reasonable laser treatment. And this is his left eye with gross diabetic maculopathy centrally, with again neovascularization at the disc and elsewhere. And this is relentless disease despite laser treatment. And you can see that large venous loop again overlying the arcade. This was his OCT. Again, you can see marked macular thickening with loss of the foveal pit, with numerous cysts, hyperreflective cysts within the retina, and this tiny puddle of fluid just beneath the retina, suggesting gross macular edema. And in the left eye, again, gross macular edema with subretinal fluid.